Hi, it's Pam with your Medicare Moves. This tutorial is to explain the different parts of Medicare and how they work together. As you can see up here in the top, we have Medicare A and B. Those are the two parts of Medicare that you purchase from the government. Medicare Part A covers you for inpatient care. When you're in the hospital, you're admitted, you're having a surgery, and for admissions into skilled nursing following a hospital stay. Part B is going to pay for doctors, labs, x-rays, MRIs, outpatient surgery, the things that we use and abuse frequently that are outside of that hospital situation. Those two parts we are purchasing from the federal government. Most often, Part A, you've worked your 40 quarters over your lifetime, paid into your taxes, and that part is taken care of for you. But there is a charge for Part B. It's based on your income. And so a lot of people don't know what it is that A and B cover and what are the difference between this Medicare Advantage plan, the drug plan, the Medicare supplement. Why would I need those, or how do I pick one? So that's what we're going to cover in this particular section. Medicare supplements cover after the government part of Medicare has already paid. So if I have Part A and I'm hospitalized, there's a deductible for that hospital stay. Currently in 2020, that's $1,408. I would be responsible for that. Medicare would pay the rest of my hospital stay for a semi-private room for up to 60 days. Part B, I have a $198 deductible annually, and then Medicare pays 80%. I would pay 20%. Do I want to be responsible for that? Well, if the answer is no, that's why people buy a Medicare supplement. So now, Medicare A and B, they pay first. There's a leftover dollar amount. The Medicare supplement picks that up. The highest plans, the more Cadillac plans, will pay all or most of that. If I have one of the lower plans, one that has a deductible, I might be responsible for up to the first $2,300, and then the supplement would kick in and pay the rest. So you can have many choices. These Medicare supplements, to keep it simple, these are the alphabet soup of the world. They have a single letter name: F, G, N, high deductible F or G. Those are some of the most popular ones. So again, Medicare, they're making all the decisions. They say what's covered. They tell the doctors how much they'll get paid. Medicare supplement pays the additional up to the maximum of all of it if you were born and got Medicare before 2020. So then we still don't have coverage for our outpatient drugs. That was added to us later, so we can purchase that and tag that on. So this is what our Medicare situation would look like if we had Medicare A and B, a Medicare supplement to pick up the medical costs that are left over, and a drug plan to help us with outpatient drugs. So how is that scenario different than a Medicare Advantage plan? Now, just to keep it from being too confusing, Medicare Advantage plans typically have names, not an alphabet. They have names like Secure Horizons, Senior Choice, One Complete. They use words, not letters. For me, that's often the easiest way for people to know which one that they're talking about, because the words Medicare Supplement, Medicare Advantage Plan, Medicare C, which is another name for a Medicare Advantage plan, just gets way too confusing for people. So in the case of a Medicare Advantage plan, I don't have these two pieces anymore. And instead of Medicare A and B making the decisions, I'm going to buy a private plan, and I'm going to put that out in front. So now this private plan, again, one that has a name, like Secure Horizons or Advantage or I don't know, use words. There's lots of different ones in lots of different areas. These are totally different than Medicare with a supplement, because now this plan is in charge. They have to do what these would have done, and you're still buying these from the government, and it's wrapped in underneath this plan. But it now usually includes a drug plan. It's one card. Everything happens on that one card. They're usually an HMO, at least in my area in California. And you have a network of doctors. Those doctors are the ones that are in charge. They decide what services that you need, what services, where you can get those services at. So for instance, Kaiser doesn't sell Medicare supplements, they sell Medicare Advantage plans. If you buy a policy from Kaiser, it's a Medicare Advantage plan. Kaiser and that plan are making all the decisions. They have to do what these guys would do, and they can add the drug coverage, and they can add whatever other bells and whistles that they want. But all decisions in the network of doctors are determined here. So you need to make a decision whether you want Medicare from the government with no list of doctors. If they take Medicare, you're in with a supplement, or whether you want the confines of an HMO and go to a Medicare Advantage plan. Why would somebody do that? Because that part didn't sound so good. Well, they're often less expensive. They have some cool bells and whistles that have been added. And if you're the type of person who would go to the same doctor all the time, do whatever it is they tell you and go where they tell you to go, it could be a good fit for you. So that's something that we'll deal with when we deal with you one-on-one and have that conversation about what's important to you and how you want to use Medicare and how you want it to work for you. But I just wanted to give you that brief primer on the difference between Medicare Advantage plans and the Medicare supplement plan, which would be going after Medicare. Okay? Talk to you on the next video.